For many of us, the war of mental health began in early adolescence. For some, the thoughts in your head were only as loud as butterflies fluttering in your stomach. For others, the thoughts felt like a constant war going on in your head. While quick fixes such as scrolling endlessly on social media may seem effective, they're only temporary. Often, anxiety lasts longer than a minute-long Instagram reel. Learning about specific techniques, cognitive and behavioral skills, as well as long-term strategies and when to seek professional help will help enhance the knowledge on coping with anxiety. I personally have struggled with anxiety since I was about 12 years old, and I've read about and practiced many of the techniques that are going to soon be talked about. First, I'll discuss specific techniques. Following that, I will discuss cognitive and behavioral skills, and finally, I'll talk about long-term strategies and when to seek professional help. There are many techniques that are specific for coping with anxiety, the first technique being sensory engagement. According to the article with the University of Michigan, using music in times of anxiety, music relieves symptoms of anxiety by helping to calm your nervous system and relax and heal your soul. Walking is an instant mood booster. Physical activity causes changes in the brain chemicals that affect the mood. Exercise increases blood flow and oxygen to the brain, releasing endorphins and serotonin. The article, Which Essential Oils Can Relieve Anxiety, written by Rachel Nalla, describes a 2017 case study on rats. The study found that bergamot oils may help to reduce anxiety-associated behaviors. Mindfulness meditation is another specific technique that I personally practiced in relieving symptoms of anxiety. Mindful meditation changes the balance of the brain activity between the regions responsible for attention. Mindfulness is the practice of being present in the moment without judgment. Mindful breathing exercises can be useful and powerful for managing stress and enhancing concentration. Focusing on slow, deliberate breathing patterns can help quiet your mind and ground you in the moment. Mindful stretching and body awareness is a great tool for athletes to recover from intense physical activity as well as deepen their mind-body connection, improve flexibility, and prevent injury. Journaling is a common technique that I use every single day. Writing helps identify triggers and track what helps alleviate symptoms. Journaling also helps to control symptoms and improve your mood by helping prioritize problems and fears and concerns. Journaling also provides an opportunity for practicing self-positive statements and recognizing negative thoughts and behaviors. It's best practices to write every day, whether it's on paper or electronically. This will help you to be able to write or journal regularly. Now that I've discussed specific techniques, I will explain cognitive and behavioral skills that help relieve symptoms of anxiety. Cognitive and behavioral skills may seem tricky to do, but with practice, they will eventually come naturally. Cognitive behavioral therapy, also known as CBT, is a widely used form of psychotherapy that aims to improve mental health by addressing unhealthy thoughts, emotions, and behaviors. Listing pros and cons may seem silly at first, but it is one of the exercises used in CBT. It helps identify the best path to take, and typically a path with less risk and consistent with your goals and priorities is best. Another exercise used is behavioral action. It is a coping skill that's designed to help you get more active even when you aren't quite feeling it. Physical activity and self-care are a great way to reduce stress and anxiety. Physical activity and self-care such as yoga can promote relaxation, reducing the stress hormone levels like cortisol and increasing GABA, which is a calming chemical in the brain. Calming brain chemical. Regular exercise provides a distraction from anxious thoughts and worries. It boosts self-esteem and confidence, which can reduce levels of anxiety. Regular exercise can increase the production of new brain cells, which may contribute to long-term anxiety reduction. Social connection is one of my favorite ways to reduce anxiety. Social connection can reduce anxiety. Having strong connections with family, friends, or support groups can really help you to feel less alone and welcome. Social interaction helps to strengthen resilience to stress. The positive connections boost the immune system, lower blood pressure, and decrease stress hormones, all of which contribute to a reduced overall anxiety level. Now that we have learned about cognitive and behavioral skills, I'll discuss long-term help and when to seek professional help. Sometimes anxiety just gets the best of us and we need to figure out somehow how to be the one in control. People often dismiss the lasting effects nutrition can have on your mind and your body. Harmful substances such as caffeine and nicotine can worsen anxiety. Providing essential nutrients like omega-3 fatty acids, magnesium, and B vitamins to support brain health and neurotransmitter production improve anxiety. Foods to emphasize includes fruits and vegetables, whole grains, healthy fats, lean proteins, fermented foods, and water. Anxiety may get the best of you blindly. Sometimes these coping skills just aren't enough. You should seek professional help when anxiety begins to interfere with your daily life, lasts 6 months or longer, feels out of proportion to a situation, or is accompanied by a panic attack. If you avoid certain people, places, or situations because of the fear of anxiety getting the best of you, you should seek professional help. Persistent physical symptoms are a sign to reach out to a professional. These symptoms include chronic muscle tension, fatigue, headaches, or stomach issues without a clear medical cause. The biopsychosocial model is uncommonly talked about. It combines biological, psychological, and social factors. Biological factors include aspects like genetics, brain chemistry, hormones, infections, physical conditions, and many underlying physiology that affects health. Psychological factors encompass emotional well-being, personality, thoughts, behaviors, coping mechanisms, and past experiences such as trauma. Social factors involve external influences such as family dynamics, cultural background, socioeconomic status, relationships, community support systems, and other environment, and the broader environment. Today, I first discussed about specific coping techniques, followed by cognitive and behavioral skills, and then I discussed long-term strategies and when to seek professional help. Learning about these specific techniques, cognitive and behavioral skills, as well as long-term strategies and when to seek professional help has enhanced your knowledge on how to cope with anxiety. Anxiety is a common struggle amongst us. It doesn't seem to be fading away anytime soon. Learning to cope with anxiety in an effective manner will better enhance our knowledge about not only the disorder but ourselves included.